Can I make workplace COVID testing mandatory? This is one of the most common questions that we're seeing at the moment. The starting point here is that there's no legal requirement for organisations to implement workplace COVID testing. As the restrictions ease, the government continues to encourage organisations across all sectors to introduce lateral flow testing. The well-known statistic that 1 in 3 people can have coronavirus without displaying any symptoms is the main reason the government is encouraging workplaces to implement testing. Staff testing also provides many business advantages. Asymptomatic testing identifies cases which may have otherwise been undetected and allows those individuals to isolate in the hope of avoiding a workplace outbreak. It also gives confidence to your staff, customers, or other visitors, helps protect your workforce and enable business continuity. That said, making COVID testing mandatory for staff carries with it a number of practical and legal risks, and in some cases human rights challenges. It's also worth remembering that the government has not made lateral flow testing mandatory even for patient-facing NHS staff or care workers. There's always the risk that employees may not consent, and there are a number of reasons why your staff may not want to be tested. First, lateral flow tests require a swab from the nose and throat, so the test is invasive and can be uncomfortable. Second, there are significant disincentives for an apparently healthy individual to take a test. Anyone who tests positive will need to take a follow-up PCR test. If this is also positive, they'll need to self-isolate, along with their household and any childcare or support bubble. This could have a financial impact if those individuals are unable to work from home, and any children will be unable to attend school. It's important to remember that employees are legally required to inform their employers if they are officially told to self-isolate. And employers will commit an offence if they knowingly allow a person who has been notified that they must self-isolate to work anywhere other than where they're self-isolating. Organisations should be aware that mandatory testing may also carry discrimination risks. There may be valid religious or medical reasons why an individual refuses to be tested, potentially putting some protected groups at a disadvantage. Some organisations may be able to objectively justify a potentially discriminatory policy, given the health and safety objectives. But organisations will need to show that testing was appropriate and proportionate relative to the risk of transmission in the workplace. Many organisations have taken the approach of encouraging testing rather than mandating it. The ACAS guidance recommends consulting with employees before implementing any workplace testing, either directly with a recognised trade union or other employee representatives. An organisation should clearly explain why it has decided that testing is appropriate and what expectations it has of its staff, both in relation to testing and compliance with other safety measures, which should also remain in full force. Organisations may also find it useful to have a written policy as a means of communicating with employees on this.